The Trinidad Eye Hospital recently conducted a survey among secondary school students to test their eye health.
The school screening program was from October 2023 to May 2024. It was 13 randomly selected secondary schools, and we did a screening of over 2,000 children just to detect the prevalence of any kind of refractive error, and at least 20% of those children needed glasses. And that's 20% who didn't know they had eye issues at all.
And found that myopia or near-sightedness is a common problem. Near-sightedness or short-sightedness means you can see near objects very well, but the distance is blurry.
So we had 40% of the students, or around 40%, had just myopia alone. Some of them had myopia as well as astigmatism, and then some of them had astigmatism alone.
One of the causes of the rise in myopia among the younger population, too much screen time.
That is attributed to the increase in near entertainment, such as tablets and devices, as well as the schoolwork now is pretty prevalent on the near devices, as well as the reduction in physical playing outside.
He recommends children engage in outdoor distance-related tasks, such as playing cricket or football.
To lessen this, I would say try to have at least one hour a day or even less for recreation, because you can't really get away from the near work these days. And natural sunlight is good for the eyes too, as well as the actual reading distance. We tend to recommend 16 inches, so that's about this distance here. Children in particular, they tend to hold the phone really close like this.
Parents are advised to be on the lookout for telltale signs of poor or impaired vision.
You could also look out for any weird behavior, such as bringing the objects really close, whether they go closer to the TV or come closer to the tablet. Another one is rubbing the eyes a lot. Sometimes children can't see, so they try to simulate vision by rubbing the eyes.
And with students preparing to head back to school on September 2nd, teachers should also pay attention to the behavior patterns of their students.
For teachers in particular, because they tend to have the most exposure to children these days, the teachers may notice that the children have a hard time looking at the board or getting correct notes down. They may be squinting, they may be rubbing the eyes. In some cases, children can't see on the board, so they tend to entertain themselves, so it's the so-called delinquent children.
According to the American Academy of Pediatrics, myopia or nearsightedness happens more often in school-age children between the ages of 6 and 14. Mr. Bridgelal says because children grow at a fast pace, it's recommended that school-age children have an annual eye exam. I'm Karen Kozia Phillip with your TTT News Health Check.